Good morning, everyone. I'll be making a presentation on gender-based violence in Nigeria, a review of attitude and perceptions, health impact, and policy implementation. Gender-based violence, as we know, describes any harmful act that is carried out against a person's will, and the act is based on socially attributed differences. That's because you are a man or a woman, that is why you are being violated in the context of that particular society. We have different types of gender violence. You have the physical violence, which includes the biting, scratching, shaking, shoving, pushing. You also have the sexual violence, that's of course, which is sexual exploitation of people, and the psychological violence, which doesn't necessarily have to be the person is being hit, but the person has the family members. Of course, there is a threat to the person's life. There is also emotional violence, where the person is emotionally blackmailed, and you have where the person is being controlled. The person cannot do his activities freely. Of course, gender-based violence occurs in different levels. It occurs, of course, we have the domestic violence that occurs. You have the intimate partner violence. You also have which occurs between mostly to female partners because of the male partners. You have the community-based violence, that's including the physical, sexual, basically rape and battery, which is usually done by people you don't even know, maybe as on the road and everything. Then you also have the state perpetuated gender-based violence, which is based on the tradition or custom of people. They actually propagate those kind of those kind of violence. Example: washing of drinking of the water from cups that is being of cups being bathed by women, by the husbands of widows of dead husbands and all that. So we have what are we in the 2008 National Demographic Survey. It shows that 28% of women are experiencing gender-based violence, and 3 in 10 women have experienced physical violence by the age of 15. That GBV cuts across all socioeconomic and cultural backgrounds. Forms of violence spans from forced marriage, physical and mental and social assault. And usually, the victims of this are usually silent. So basically, we try to see, okay, what are the attitudes? What do people think? What are their perceptions towards gender-based violence? We're also looking at the health impact. Now, those people that are being violated, victims of gender-based violence, how has it affected them? We are also seeking to see the growing trend of gender-based violence. And knowledge gained from this article, we hope would actually show new frontiers of research to help curb gender-based violence in Nigeria. For my method, I actually got materials on gender-based violence through electronic databases such as Google Scholar, Medline, PubMed. Then these materials were selected based on search terms. That is, if there is nothing related to attitude, perception, or health impact, those materials are rejected. Articles that are not also related to Nigeria, that is, studies that are done in other countries other than Nigeria, were also excluded from the study. And articles done in other languages apart from English language was also excluded from the study. As result of the literature shows that result of the search, 21 articles met the criteria, Two main categories of gender-based violence were commonly studied. That is the intimate partner violence, that's the domestic violence, and the community-based violence. 8 of these articles reviewed focused on attitudes and perception of women to intimate partner violence, and 2 focused on the perception of men on intimate partner violence. And 4 of these articles also focused on health impacts of health impact of gender-based violence on their victims, and 5 articles focused on policy implementation of gender-based violence in Nigeria. For attitude, most of the articles reviewed that focused on intimate partner violence, particularly wife battery, and 3 focused on gender-based violence perpetrated among youth, but this study was only restricted to students in the university. It was observed that GBV, that's gender-based violence, is perceived by the participants to occur almost in every home. And it is observed that in every part of the country that gender-based violence is justified for reasons such as you go out without telling your husband, you are disrespecting him, you are arguing with him, or you refuse to give him sex and all that. Even burning the food in the house, maybe mistakenly or not, could actually result in gender-based violence. That men actually justify gender-based violence for the same reason that women justify it, that a man beating his wife is a way of showing authority, and that the woman is a weaker sex. Unfortunately, the women in the study also view themselves in the same light. Like the Hausa ethnic group is likely to justify gender-based violence than any other ethnic group. That the women in the study also have an attitude of not reporting their perpetrators. In fact, they suffer in silence most of the time. That's one of the reasons why you rarely hear about the reports of gender violence. A majority of them rather keep it to themselves or report to their close family and friends. Majority of the articles reviewed on gender-based violence were among them university students. Basically, as I'm talking about rape now, and they see rape as a crime, but they do not recognize marital rape, nor was rape between a boyfriend and a girlfriend considered as rape. The women all in the study reviewed that they would rather not live a violent marriage because of gender-based violence, because of the fear of being a burden to their parents, or a fear of being called a prostitute because they left their matrimonial homes. The health impact of, basically, we know that we have the physical effect of IPV includes the bruises, the injury, strain, dislocation, burns, which could be from minor to major. You have broken bones, broken teeth, and other severe conditions, serious conditions. The physical health impact of rape include the sexual transmitted infections, as well as unwanted pregnancies and body injuries. IPV in pregnancy, that is intimate partner violence in pregnancy, also resulted to abortion, premature labor, and depression. Of course, victims of GBV also suffered from post-traumatic stress disorders, and basically the social health impact is shame and isolation. Rape victims face stigmatization because everybody feels it's their fault, and hence they are being stigmatized for being raped. Isolation and poor relationship. Then, of course, the health seeking, majority of people being violated as victims of gender-based violence do not actually seek for help when they are being violated. So, on policy implementation of gender-based violence, it's only one study that I could actually lay my hands on that could evaluate policy implementation of gender-based violence. And it was the study was by Ilika and Ilika 2005, which demonstrated on how policies on gender-based violence are developed and implemented. Although some of the forms of gender-based violence, like baiting, ritual for baiting and washing of corpse, are still in force for a shorter period of time. Practice such as widows losing their lands due to due to lack of sons has not been abolished as at these studies, and these practices are due to tendencies of being reinstituted since these practices that even that have been abolished, such as these baiting rituals and all that, has a danger of being reinstituted because there are no sanctions to actually serve as a deterrent for people to prevent them from actually doing the violating people. So this set of data presented in this review is limited, but there was a lot of more studies that can be done on gender-based violence. GBV programs needs to be developed. We need to develop innovative strategy to reaching out to victims who suffer gender-based violence in their homes, because most of them do not report. Although most women feel that domestic violence is not excusable, the fact that some of them actually feel that it could be excused in some conditions is actually disturbing. And reasons could be that they find themselves trapped in an environment that actually tells them that that they have to cope, that it is something that is normal and all that. So they end up accepting that gender-based violence is okay. Another plausible explanation is that some women also do that because their ecological environment, that is all the interconnected elements within their environment, it's actually in favor of the batterer. So as a result of that, the person actually accepts or perceives gender-based violence as a norm. Hence, there's a need to work on improvement and correction of this perception. This would actually be beneficial in reducing the health impact of gender-based violence. In Nigeria, even after signing after several decades of employing the CEDWA, they've agreed that gender-based violence is not good, and they are supposed to have domesticated it. Right now, it's been slowed down in Nigeria, and of course, Nigeria is made up of many ethnic groups, and each of these ethnic groups have different customary laws, and of course, most Nigerian customary laws, particularly the Igbo custom, are fraught with actually legions of discriminatory practices against women. So the Nigerian constitution also legalizes rape and gives minimum sentence if assault is perpetrated on a woman, and legalizes women chastisement. It shows that gender-based violence in Nigeria is just paid a lip service, and nothing actually is being done to reduce gender-based violence. Despite this limitation, Ilika and Ilika 2005 shows that if there is a community participation, if a community is brought together to explain the issues of gender-based violence, and agenda is being set against prevention of gender-based violence, there is a lot of successes has been actually documented as a result of that. So these are the references I used for the study. And in conclusion, the review has highlighted that there is a need for more studies to be done on gender-based violence, particularly other forms of violence. There is also a need for a more objective study on physical, mental, and social health impact of gender-based violence. Presently in Nigeria, we have Ebonyi State, Jigawa, Cross River, and Lagos State who have enacted domestic violence laws. Enugu, Edo, Bayelsa, Delta, Cross River, and Ogun State have also passed laws against female genital mutilation, but there is also a need to evaluate implementation of these laws in these states. Thank you for listening.